Welcome to another episode of Hudson Health. My name is Dr. Sakiba Syed, and I'm hosting today's show. Dr. Amir Syed, my other co-host, isn't here today because he's busy taking care of patients. Today, we'll discuss some impacts of COVID that's affected the community. We're honored to have a guest today. His name is Dr. Louis Astudillo, who's a cardiovascular doctor out of Hackensack Hospital. Thank you, and we'll be back with Dr. Astudillo.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back to Hudson Health. My name is Dr. Sakiba Syed, and I'm the host today. Again, my brother, Dr. Amir Syed, is not today because he's busy taking care of patients. We're honored today to have our guest today, Dr. Louis Astudillo. Dr. Louis Astudillo is a physician, a cardiovascular doctor at Hackensack Meridian. He received his MD at the Libre University School of Medicine. He completed his residency at Mount Sinai Medical and fellowships in cardiovascular disease at Valley University and Mount Sinai Medical Center. He also completed postdoctoral research and advanced cardiac imaging at Mount Sinai Hospital. Mr. Astudillo, Dr. Astudillo, I apologize, is a board certified in 5 areas. That's very impressive. In cardiovascular diseases, in internal medicine, in cardiac computer tomography, and cardiac nuclear medicine. He's a member of the American College of Cardiology. Dr. Astudillo has published articles on the understanding of valvular heart disease in several journals. He's affiliated with Hackensack Meridian Hospital. Welcome, Dr. Astudillo.
Hi, good evening, Dr. Said. Thanks for having me. It's my pleasure.
So COVID has affected everybody. And being that it's the heart month that we worry about cardiac disease and cardiac health, and this is actually your month, we really want to know what the impact of COVID is on cardiovascular health. Imaging tests taken months after recovery from COVID-19 patients, even months after, show lasting damage to the cardiac muscle, even in people who've had mild symptoms. As a result, patients are known to be at increased risk for cardiac disease and heart failure. So we'd like to have your intake on this and what you've dealt with when it comes to COVID affecting the heart.
Yes, that's true. Has been already a year that we haven't seen patients initially in the hospital. And in the beginning, cardiologists, we were called for acute cardiac complications in the patients that initially we thought that was only a pulmonary issue. We know from the beginning even before we got the first patients here, and data coming from our colleagues in China, that they have described different kind of complications for the heart in COVID patients. In particular, several degrees of inflammation compromising or expressing in the patients in different ways, in arrhythmias, in heart attacks, and also in thromboembolic events. Not only talking about cerebrovascular accidents or pulmonary embolisms, but related with heart attacks per se. That was a year ago, and the time has passed and has evolved in kind of different stages for this. Several of us has been at front since the beginning, and has things evolved over the year. We start to see a different kind of scenario on patients, not in the acute setting in the hospital, but also in the office. And most of these patients, believe it or not, they were initially mild cases of COVID-19, cases that they were taking themselves at home with just pragmatic measurements, but then lingering with the symptoms. And the symptoms included some symptoms related with the heart. So that is how we have been involved and impacted, over the last year.
So what tests are being done right now to diagnose these patients early on?
It depends on the scenario. We have to talk about two different kind of patients. One of them, very different patient, is the patient that is at the hospital, in whom the acute complications, the acute cardiac complications are found usually very fast in a time fashion. And in the hospital, we had several resources from the imaging standpoint, from the laboratory standpoint, to make the right diagnosis. In the office, it's kind of different because the patients are not in acute setting, and they present with a widespread kind of symptoms. And everything starts with the bedside communication with the patient, the physical exam, and just simple testing. I'm talking about when you are in the office setting.
So as an internist, like for myself, are there any tests that I should do in the office to monitor these patients?
Well, yes, I believe that in the office, and if the patient is presenting with, many of them with recurrent or persistent shortness of breath, if they are presenting with symptoms of palpitations, or even chest pain, sometimes a typical chest pain, you have the opportunity as a primary to do some testing right there, which obviously is the physical exam, but then you can do an electrocardiogram, a surface electrocardiogram, that will help you to find any kind of particular arrhythmia at that particular time. You can do other kind of imaging, as is chest rate, that will tell you the compromise of the lungs, if the patient is having shortness of breath, if there is auscultation, it's abnormal, the size of the heart. And blood testing. And also something, before I forget, the blood testing, something very important, the office do oximetries, because you can scale the patient, know how the autosats are at that moment. And if the patient is having a normal autosat, obviously that will prompt different kind of testing or refer the patient to a different specialist, will be the cardiologist or the pulmonary. Knowing, the LTSAT has to be about 96% of rest.
This
And
pandemic
then
has
blood
gotten
testing.
everybody to
Blood
get
testing
these pulse
is,
pulse oximeters. Everybody's got them at home these days, so they're
Yeah.
trying to monitor their own symptoms and trying to communicate those issues with us. We'll be back after a short break to ask you some more interesting questions. Thank you.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self Storage. Let us be your good friend.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
Welcome back to Hudson Health. We're here today discussing cardiac effects of the COVID-19 infection. We are honored to have our guest today, Dr. Louis Astudillo, a renowned cardiologist from Hackensack Meridian, and we're asking him some really interesting questions and how, as us physicians, internists, can take care of our patients, and how you patients can actually ask very important and very essential questions to your caretakers. And it's extremely important to be in tune of what you feel like and how you're feeling. Don't underestimate the symptoms of shortness of breath and palpitations and chest pain after having the COVID-19 infection. So Dr. Louis Astudillo, a really quick question. Any irregular heart rhythms that you've noticed that happens more in patients that have had the COVID-19 vaccine? I mean, not vaccine, the COVID-19 infection.
Yes, has been at least a couple of arrhythmias that has been seen frequently in the hospital. And is one of the most common arrhythmias. It's called the atrial fibrillation. At least 4% of the population has it. And one similar to that one is atrial flutter. The other kind of arrhythmias is called supraventricular tachycardias, but in particular that one, you have to keep a name, it would be atrial fibrillation. There are different kind of hypotheses why this arrhythmia is more frequently happen, and probably is related with the degrees of inflammation that the COVID has produced in the heart. Something to remember is that the heart is very prolific in the kind of receptors that this virus used to get into the cells, and has been shown that the replication of the virus in the muscle cells. So it's thought that this is the primary mechanism why atrial fibrillation is so prevalent in the patients. But worse than that is that there is a correlation now with the finding of atrial fibrillation in the patients in the hospital and the mortality within the hospital and after the hospital. And so the sickest patient seems to be the more prone to have atrial fibrillation.
So then I jumped into my next question before. Do you have any concern of the COVID-19 vaccine itself causing any cardiac side effects?
Really, no. Has not been described as far as I know. The vaccine per se, at least the ones that are being used at the beginning, produce a messenger RNA in which it prompts, their own cells to produce the antibody against this particular receptor of the virus. And has not been related with any particular cardiac or arrhythmia issues so far diagnosed or reported. So in that
that's
sense,
important.
I think that the vaccine is
Absolutely. Thank you so much, because this is reassurance. A lot of patients in the community and a lot of members of the community are hesitant to get the vaccine. Misinformation, a lot of wrong information, social media spreading some information that's not really validated, and it's actually taking away from the progress that we're trying to establish in establishing herd immunity so that the community is actually safer and healthier. So what steps are Hackensack Meridian taking right now to help educate the community? I think this is extremely important. Patients, they're coming to the offices, they're asking their physicians, their specialists, all these side effects and the fears, and I always try to go back and give them information. Some people want to take information home before they want to commit to getting vaccines. Any thought on helping promote the awareness of the safety of a vaccine in the community?
Well, we do it, and I do it at the office all the time. Also in the hospital, when the patient is able to communicate in a good way. In the office, I just go for what I'm seeing for a year now, what I have read, about the vaccine, how it has been developed. I think the vaccines are safe enough, are extremely effective, and I tell to the patients the only way that the vaccine will work if the people gets vaccinated, and that's as a general rule in all the vaccines. If the people don't get vaccinated, the vaccine is not to work.
I agree. Now, next question, women. Women are usually diagnosed with cardiovascular diseases in not the typical way that men usually are. Their symptoms sometimes are a little difficult to diagnose, and they're not that typical chest pain, having a severe heart attack that's going down the arm. Has the COVID-19 infection affected women differently as opposed to men?
Really no, compared with the things that we know, as you expressed from before, the different way that the symptoms sometimes appears in women. The things that we have done with the COVID and the cardiovascular system is to extrapolate all the knowledge that we have from the baselines and trying to apply those guidelines, the same principles of the guidelines that we have even before the COVID, trying to apply during the COVID pandemic. And I think that that's the best way to go, because when you have something that you are still learning in the process, because that is what we are. We are in the process of this COVID, and trials are ongoing still. You have to apply for what you know from the baseline, but COVID in particular has not affected in a different way women compared with the men from the cardiovascular standpoint. The testing, the kind of testing is done accordingly with the particular symptoms, but always knowing that the manifestations can be different. as even before COVID.
Now, the 3 vaccines, now we have the Johnson & Johnson one coming out. Do you have any, I know they're comparable, and the Johnson & Johnson has that little benefit of only being 1 shot as opposed to the other 2. From your perspective, is there any one better than the other? My understanding is that they're all comparable, but patients always will ask me, which one is better. But I guess we'll come back to ask you this question after the break. I'm running a little over. Thank you.
Stevens Jersey City Ford, located right off of NJ 440 North. Across the Hudson Mall is your one-stop for all your automotive needs. Check out Ford's latest models like the 2020 Ford Fusion with its stylish looks and hybrid options, or the unparalleled high-performance 2020 Ford Mustang. The 2020 Ford F-150 Raptor is ready for those rugged off-road terrains with trail control. Need a mid-sized truck for your towing and hauling? The 2020 Ford Ranger will deliver. The 2020 Ford Escape is a luxury SUV that was made for comfort and adventure on the go. Returning is Ford's legendary Bronco, which takes you back to the true meaning of off-roading. They are now available for pre-order in our showroom or on our website. Let us help you find your next vehicle. Stevens Jersey City Ford, 201-432-7272.
Pan & Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panandpintoproperties.com. Pan & Pinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. My name is Dr. Sakiba Syed, and today we're honored to have Dr. Louis Astudillo as a guest in our studio. Thank you. Dr. Astudillo, so getting back to the question I asked earlier, any difference from your perspective from any of the 3 vaccines that are being offered right now?
I think the effectiveness of all 3 are very high. I don't see in the original papers report any significant difference between them, except for what you said, the advantage of Johnson & Johnson vaccine being only 1 dose. That obviously is an advantage because vaccination is not easy. So having the patients 2 doses of vaccination, it takes a lot of logistics to do it. So obviously 1 dose of vaccination, if the effectiveness is up there compared with the other 2, will be advantages for everybody. But in terms of the coverage of the vaccine, for the virus, I think that they are equivalent. I haven't seen any report of any significant difference between them. In particular, more experience with the first 2 vaccines, the Pfizer and Moderna, which are very similar, and
I agree 100%. And it's always reassuring to hear from another specialist that they're pretty much the same. And the most important thing is that our community gets vaccinated so that we all get that point of herd immunity to that point where that transmission is not happening and the infection is not propagating, and we can see some light at the end of the tunnel. So, I think education, awareness, and us, asking our patients questions if they have any questions. Some people just need validation or confirmation, and maybe just unfounded fears need to be addressed. And I think that's a main problem that I'm dealing with in the office. I know Hackensack is offering a wonderful post-COVID-19 service to the community. Patients who've had COVID-19, they have tele-screenings that are being done, and they're being actually offered services to being monitored based on what their symptoms are like. So it's really important for the community to know that those services are out there. Furthermore, Jersey City itself, I know it's a logistical issue of getting the vaccines to the patients. A lot of people want them and they just can't get them. And, we're always telling everybody, go to the website, jerseycitynj.gov, and the phone numbers are there. Call them, register yourself. They are taking appointments. They are giving vaccines. So just be patient, but definitely try to get yourself registered. Hackensack itself, you go to their website, which will be listed. Go to their website, they'll give you information about the COVID-19. We're still very much neck deep in this pandemic. We're not out, but we all need everybody's support in trying to see the light at the end of the tunnel so we could have a great summer and the end of the year. Again, the things that we want to let the patients know: difficulty breathing, shortness of breath, any cough, any fevers, any headache, any loss of sense of smell or taste. Please don't hesitate to get yourself tested. Call your primary care doctor. Quarantine yourself and avoid social gatherings at this moment. We continue to enforce public health measures. We want you to wear your mask, social distance yourself, and continue washing your hands. If there are any mental health conditions that are associated with the COVID-19, which are very real symptoms of anxiety, of stress, of paranoia, please reach out to your doctor. We're here to serve you. We're here to diagnose you. We're here to hold your hand and get you through these ailments. These are symptoms that are very real, and we're dealing with this day in and day out. Dr. Astudillo, we really appreciate your input on anything. Is there anything you'd like to add?
Yeah, probably last thing is that the message is do not ignore cardiac symptoms. One of the things that we saw last year is that the numbers of acute coronary events, talking about heart attacks, even stroke, were for no reason for us, we see less numbers, was decreased. And the reason of that is the patients stayed home. That may cause, increase of the mortality. So the last message is that don't ignore the heart symptoms, especially if you have a heart condition, because getting the care is critical for you recover faster, and you may limit the damage that you may have in your heart.
I agree 100%. And just to reiterate and reinforce that the hospitals are extremely safe. If you have any cardiac symptoms, like Dr. Astudillo said, any shortness of breath, any chest pain, any palpitations, anything out of the ordinary, please don't hesitate to go to your local hospital, Jersey City Medical Center, Hackensack Meridian, there's Christ Hospital, Bayonne Hospital, whatever is the most closest hospital to get to. Please don't ignore your symptoms. These are serious symptoms, and you can prevent cardiac damage and even death. Unfortunately, COVID has taken over 500,000 lives since this pandemic began, so it is a very grave milestone that we've actually passed. We still need to be very vigilant about this, and these symptoms are very real. How it affects different parts of the body is extremely important, so don't ignore your symptoms at all. Thank you again for joining us for a great segment at Hudson Health. Looking forward to seeing you again.